Is there a normal amount of hair to lose in the shower? Because I have big curly hair, my girlfriend has big curly hair, and we have to drain our situation like once a week. Is there a
You
normal
got it on
amount?
like subscribe and
Yeah,
save.
it's like I have it on auto
Yeah.
like delivery. What's up, everybody? I'm JC Mendoza. I'm your host, and this is Uncomfortable Questions. With me today is board certified dermatologist and hair loss specialist, Dr. Knox Beasley. Dr. Knox, I'm happy to have you. How are you doing today?
I'm good, doing good. I'm doing good. I'm pumped to be here.
Good. I'm glad you said good 3 times. So now I feel like everything is. I feel like everything's good, 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 and that's how I like it. But I feel like we off the bat should just state the obvious. You're a doctor. You have a very stressful job. You have a lot of people's well-being in your hands. Me, I'm a stand-up comedian. Very stressful job. You know, just equal. I think we could of equal importance. We both provide. I would say nobody would argue the same value to society, and that means we both endure some stress in our day-to-day job. But what I do want to ask you is stress a trigger for any type of long-term hair loss?
Yes. So a lot of times when we think about hair loss, we're thinking about male pattern type hair
Yeah,
loss.
yeah, yeah.
Stress is really more contributing to a different type of hair loss that we have called a telogen effluvium, which is where stress is really just interrupting that hair growing cycle and just making you shed way more than you should be.
Okay. So is it possible that stress can cause that like male pattern type of hair loss situation, or is that completely unrelated?
Not so much. I mean, it's not good for you in general
Right.
to have stress. So, can you say there's absolutely no contribution at all? But it's really not the main driver.
Okay, cool.
Male pattern hair loss is more like your genetic factors, DHT. Those are what's driving that.
Okay, so genetic factors would be more for like pattern loss as opposed to stress, which would just be what would stress related hair loss look like?
Sure. So that's a great question. When we talk about a male pattern type hair loss, it's usually on the crown, frontal scalp, slow, progressive over the years. When we talk about stress hair loss, and stress can have there's different types of stress.
Right.
So you can have these big emotional life events. You can have an illness, a surgery. Childbirth is a big one,
Yes.
So when you have these big moments, those can cause stress as well. And sometimes it can be chronic stress or a nutritional deficiency. So stress means a lot of different things.
Right.
And when you have this, it's more of a rapid, like all over type shedding. So
Okay.
you're like, hey, I was fine. And then all of a sudden I'm finding hair all over my pillow. It's
Right.
clogging my drain in the shower. Like that's when we're thinking more like a stress type hair loss.
Okay, understood. And I know hair loss is something that like happened like in the shower, for example. That was a trigger for me because me and my girlfriend, we both have a lot of big curly hair and we both lose a lot of hair. Is there like an amount of hair that should be like I should be alarmed by? Because sometimes I feel like I pick up pretty big chunks up out of the drain, and I don't know if like I have a problem or if this is normal.
Yeah. So on average, we lose about 50 to 100 hairs a day.
All right.
It's
So
about normal.
tomorrow I'll be back, and I'm gonna come with the clump, and we're gonna sort through together one.
Yeah,
by
we'll do
one
the hair
to
counts.
make sure if it is 51, get ready to see me in your office. And how can you tell what type of hair loss that you're experiencing? I know you said pattern might start in the crown and stress might be all over. Are there any other indicators of like the different types of hair loss and like what's happening that would differentiate them?
Sure. So there's really not a lot of tests for these outside of like a nutritional deficiency. You got an iron deficiency, you have to test your iron. But for the most part, it's when you have that stress or that life event, it's usually a couple months later, we start to see that rapid shedding. So when someone comes in and saying, I'm thinning all over, that's when I start, were you sick? Did you have surgery? What happened before this? And we try and figure it out and be like, all right, this is probably what's going on. But it's really a lot of clinical clues is what we're looking
clinical
for.
clues. So let's say you see some of those clinical clues and somebody that you're dealing with is experiencing stress-related hair loss. How would you treat that?
So the treatment with the telogen, first thing you want to do is treat the underlying cause. You got an iron deficiency,
Gotta
treat
get
your
some
iron.
iron.
If you got chronic stress from your job, we need to see a mental health expert.
Yeah, maybe take
try
a
and get
couple
that under
days
control.
off at the very least.
For these one-time events like a surgery or things like that. With a telogen, the good news is the hair, when it's stress-related, it will come back.
Right.
The bad news is I can't tell you exactly when, and that can be frustrating, but it will come back. It's usually about 6 to 12 months later is when it's going to happen. There's not a lot of wonderful medications that work amazingly for it. Minoxidil can sometimes help because that can help with help get the hair growth cycle going.
Right.
So we use that sometimes, but a lot of it's time too. It'll get better.
Time. So you might be stressed out, you might lose some hair, but you don't have to lose any faith. It's going to be okay. And I'm just repeating that. Like you said, good 3 times in the beginning. We're going to be good. We're going to be good. We're going to be good. And you're going to be back for more uncomfortable questions with Dr. Knox and myself, JC Mendoza.